I joined the forum about 6 months after they'd initially got up and got running, and we then sort of started to as we gelled together, develop a work plan of issues that we thought were relevant to the trust and should be tackled, as a group sort of thing. And one of the things that we've chosen to look at is transport. It's always an issue within our local county. The cottage hospitals, the community hospitals and the rehab and things has been moved out into more local communities, and often that can mean people from urban areas or even other rural communities being transferred a long way from home, and that so people using public transport can often find, especially in the evening for visiting, it very difficult to access those hospitals. I'm lucky that I drive, so I've got the issues around parking and then where I park, getting to that appointment, and obstacles and barriers that are in the way. Obviously for someone that's not driving, then you've got the public transport and the arranging to get to hospital before then. As an issue for me, as a disabled person, I recently moved house, 3 years ago now, and one of my divining choices on where I was going to move was the fact that there was an accessible bus route into Taunton. I soon learned the first time my vehicle was off the road that accessible bus route isn't a 100% accessible bus route all the time. Often wheelchair spaces are quite plentiful outside of where you need to go, but the volume of people with blue badges using a hospital is normally so high that that's always the popular site, and unless you're there and have a considerable amount of time to spare to wait before your appointment, then you often don't get to park in those prime spaces and end up parking in perhaps a disabled bay, which is some considerable way from your appointment. It's about raising awareness and working with the trust and the hospital staff to make them aware, because often many people, they are willing to make changes and work to make things easier for disabled people, but they just aren't aware. So I think some of the important work that the forum does is about raising that awareness.